Hi everyone, this is my pulmonary embolism case presentation. A 46-year-old male presents to the ER with sudden chest pain that worsens on inhalation, tachypnea, low-grade fever, tachycardia, and hypoxia. Within the last month, he broke his left femur in a severe motorcycle accident, requiring reconstructive surgery, and has had limited mobility since recovering. His chest x-ray is normal, but his ABG indicates hypoxemia with a PaO2 level of 68, so a computed tomographic pulmonary angiography, or CTPA scan, is ordered. Subsequently, he is diagnosed with a moderate segmental PE. Upon ultrasound of his left leg, a DVT is visualized in his left iliac vein, which is a common site for DVTs to progress to PEs. His blood pressure is on the lower end of normal at 110/50, so an echo is ordered to assess for right heart strain, which confirms moderate right ventricular dilation. The patient is placed on supplemental oxygen and telemetry. A heparin bolus and infusion are administered, with a plan to transition to a 3-month course of warfarin since his venous thromboembolism provoking factor is reversible. Vascular surgery is consulted for possible thrombolysis, and the patient is admitted to the CVICU for closer monitoring.